57643 is an oral small molecule BET inhibitor or bromodomain inhibitor, a pan-BD inhibitor, most selectively targets BRD4, that we're studying in a phase 1 dose escalation and expansion study in patients with advanced myelofibrosis, either relapsed refractory myelofibrosis, in which case we're using monotherapy with the BET inhibitor, or for suboptimal responders to ruxolitinib, where it's an add-on therapy. And those are two different parts of the study, part 1 and part 2. Part 1 is now in dose expansion. The MTD was 10 milligrams a day. And part 2, the combination therapy with ruxolitinib, is in dose escalation at 8 milligrams, which we think is probably going to be the right dose there. One thing I'll add about the expansion phases of the study is we do allow different dosing of the BET inhibitor based on a patient's platelet count. For example, on the monotherapy dose expansion, it could be 6 milligrams or 10 milligrams daily, depending on their starting platelets. And that cohort includes both MF patients and now also ET patients who have failed standard therapy. The trial initially did have, as part of the dose escalation, a cohort that allowed MDS and MDS MPN overlap syndrome patients, but really now it's exclusively focused on advanced myelofibrosis, with the two cohorts being again monotherapy and combination therapy in suboptimal responders to ruxolitinib. There's a big unmet need in both groups. The monotherapy patients may have failed multiple lines or be just completely intolerant or refractory to JAK inhibition. And so it's really nice to have an active single agent there, which we've seen in that space for those patients, and we can discuss in a minute. And then the suboptimal responders to ruxolitinib, often they really aren't doing that well. And so if you can deepen that response, improve their symptoms, improve their spleen size, on top of what Rux already did, and in addition improve the anemia, I think you're really helping the patient.